Hi guys, one of the many problems facing the NHS when the Tories were in charge, and there were many of them, was the issue of strikes. Doctors and nurses were expected to work more for less. Their pay was essentially frozen for years, which resulted in many leaving to work in the private sector and others leaving the country entirely for better paying conditions in places like Australia and Canada. The alternative to that, of course, was to go on strike, resulting in delayed or cancelled appointments. So whenever the media challenge government ministers over a pay hike for junior doctors, it isn't really a pay increase, but more a pay restoration. Here Stephen Kinnock was asked by Kay Burley why he was asking for improved productivity from GPs and not junior doctors. Have a listen.
There's a big opportunity around primary care and productivity in GP surgeries. We're going to adjust the quality outcomes framework so that GPs are incentivised to have continuity of care. It's basically around bringing back the family doctor.
Okay, and the reason I'm asking is because you gave junior doctors a 22% pay rise without any corresponding commitment to higher productivity.
Well, the strikes were costing the country £1.7 billion
but that's a fact,
year.
Isn't it?
And all of these targets we've talked about today, none of those would have been achieved if my colleague Wes Streeting hadn't gone in and sorted out the strikes within a week of us coming into office.
But why not ask for a commitment for greater productivity at the same time?
Well, look, I think everybody's committed to greater productivity. The plan that we're putting forward, the big national conversation we're having today, productivity is going to be at the heart of that. And it's a fantastic example. It's a fantastic opportunity for everybody to get involved. That plan that we publish in the spring of next year is going to be all about driving up productivity, modernising our health and care system, keeping it free at the point of use, but in a modern setting. And the productivity side of that, both in terms of moving people away from the acute sector, so hospital to community, using tech more effectively, so analog to digital, and getting people's lifestyles improved so that they don't have to go and use the health system in the first place. Well, that's going to improve productivity.
So why didn't you ask junior doctors for a commitment to higher productivity when you said, there you go, 22% pay rise?
Well, I think it's absolutely built into the system that we've got to improve productivity. Every single junior doctor in the country knows that. They're totally committed to doing that. But those strikes were costing the country £1.7 billion a year. And let's not forget what we've achieved in the last 14 weeks. We've sorted out the strikes. We put 1,000 new GPs onto the front line.
Created a £9 billion black hole in the process.
We've brought legislation in for a fair pay agreement for adult social care workers, 130,000 vacancies in adult social care. We've done more in the last 14 weeks than the Tories did in 14 years.
Okay. Look, maybe I'm missing the point here, and I really don't understand why Stephen Kinnock didn't raise this point. Junior doctors and GPs are very different. What I mean by this is, junior doctors, as was pointed out at the beginning, were leaving the profession. Nurses as well, leaving the profession in order to work in other countries, for example, in Canada, in Australia, where pay and conditions are better. Or they were leaving the profession to work in the private sector, for example, supermarkets. So that was an issue. The remaining doctors and nurses were going on strike for better pay and conditions when the Tories were in charge. So in order to resolve that problem, they received a pay restoration, not really a pay hike, just a pay restoration, in order to stop them from leaving. Now, you need to increase their pay if you want them to work more, if you want to encourage more people to join this sector. But when it comes to the difference between GPs and junior doctors are not in control of the system. They're not deciding how many patients they see. They're completely different. So, for example, a GP is a bit like a mini hospital or a mini NHS. They have to make sure they have enough equipment. They have to order that stuff. They have to manage a staff. They have to decide how many patients they see. They generally are in control of their calendar. They're completely different. So if you're asking for more productivity from the GP, that's understandable. Whether they can actually deliver that is another thing. But it's ridiculous to say, well, why didn't you ask junior doctors for higher productivity? The productivity that junior doctors can deliver is dependent on the NHS, not on the junior doctors. Or it's very limited what increased productivity junior doctors can deliver by themselves, apart from working more hours. But if there are problems in the system, in the NHS itself, there's nothing to do with junior doctors. They can't improve productivity, unless I'm missing something. So you're comparing apples and oranges here. I know it's cool, maybe, it sounds great to throw out this, oh, you've increased the wages of junior doctors without asking for a productivity increase. But it makes no sense. Once again, if the system has problems, the junior doctors have no control over that. While if the GP is using an outdated system, or if the GP is not working to the best of their ability, you can help them out to increase productivity.